My name is Joss Palmer, and I am the Connecting Care Programme Lead. And I'm going to talk to you about some of the work that we've been doing in the past year or so. And they've all very much got safeguarding at the heart of the work. And as well as that, there are kind of three common themes that have woven through them. And that's really around kind of chance or opportunity, the challenge that there is, and also the role and the importance of champions. So before I kind of get in and tell you a bit more about those projects, I just very briefly touch on Connecting Care and who we are. So we are based in Bristol, but we cover the North Somerset and South Gloucestershire area as well. And I guess in common with all of you, our main purpose is all around how can we better share information digitally to support better care. And we've been going at this for a while now. So it was back in 2011 that we had our initial vision for doing something. And we started work in earnest back in 2013 and have been working on that ever since. And this is the we. So you probably have something similar where you are. And it's a combination of acute trusts, community health providers, local authorities, mental health, CCGs. And then we've also got kind of a smattering of, like the Academic Health Science Network, who've been fabulous, NHS England, and also our commissioning support unit. So it's quite a rich mix, and at times it is super challenging. So the three kind of areas that I'm going to talk to today are all around safeguarding, and these are, I guess, some of the fairly obvious motivations around why we wanted to do something on safeguarding. And I'm sure this kind of thing is familiar to you. So the first project I will talk about is our children's project, which we did in conjunction with our three councils, our three local authorities. And I suppose just a little bit of context around children's safeguarding. You might have seen some of the statistics that came out, I think just in the last week really. About 90 children a day are placed in care. And I think that the NSPCC say that there are at least 58,000 children who are, in a very vulnerable situation and needing protection. And I think the children's kind of champion for England said, I think it's well over 600,000 children live in very high risk situations. You might remember or be able to recall well some of the really tragic cases like Baby P and Victoria Colombier. But there are actually over 40 serious case reviews a year. So it's a really huge problem. And with the number of children in care now at record levels, it could get worse. So that's why we went about doing our children's safeguarding project. And what we delivered is, through doing this project, is really an ambitious set of data around all children that are under social care. And that information is available to all Connecting Care users. We have woven in some kind of refinements in terms of roles. So for example, some people are able to see things like a placement address. So, if the child is in foster care or in a children's home. And there are also a small number of people who are able to break the glass even if someone has opted out. That's what we've done. And I have to say, this project was hard work. So I'll touch on some of the challenges we had around this in a moment. But it is delivering benefit, and for example, I was talking to one of our lead GPs who was saying he saw a young mum with a 6-week-old baby, and there were just a few things that concerned him, and what he was able to do was look up on Connecting Care, see some of the details around the kind of plans in place, immediately get in touch with the named social worker, have a bit of a conversation about it, and just really share what was happening and the concerns and the plans were in place. So that simply couldn't have happened as easily without Connecting Care. And I don't know whether that means that there'll never be another serious case in Bristol. Sadly, I doubt it, but I think we are doing what we can to really try and improve the situation through this project, and I'm incredibly proud to have been part of it. The second safeguarding thing that we've done recently is all around homeless health, and pictured here is Dr. Mike Taylor, who is actually our clinical lead for Connecting Care. And Dr. Mike used to work in a rather lovely leafy green GP practice, and has recently, or relatively recently, moved into homeless health. And he has become a real champion for the importance of sharing information for hard to reach communities. So Mike says, and I love Mike, but he says that the mark of a civilized society is how we treat people who are down on their luck. And so Connecting Care is now routinely being used in the homeless health setting, and it for example, benefits like people being able to see that somebody is under a special mental health service means that perhaps somebody doesn't get sectioned unnecessarily, or they don't spend a night in the police cells. So it's delivering benefit to those service users, as well as making life a lot easier for the doctors and nurses that work in that area. And through Mike, we're also starting to work with some of the third sector and voluntary organisations, people like Street Triage, Bristol Drugs Project, St Mungo's, so charities and so on, and even working with some areas that support sex workers on the street. So that's been a really sort of kind of fascinating area around safeguarding that we are moving into. And finally, our safeguarding thing that we're literally just starting to do is to roll out a pilot to the police safeguarding unit. As it says there, the SCUs act as a kind of central point where it could be domestic violence, it could be a vulnerable adult concern, it could be concerns about a child or missing persons. And what the SCU has to do is to try and really establish, do they need to take action? Should they refer on to somebody else? And they've really been blighted by lack of information or all the effort that it takes into that kind of finding out process. So what we're going to be doing is a pilot running with the police for about 6 months, and through that work we'll be looking to see if we can establish if there are benefits to using Connecting Care in the police safeguarding unit, and also talking to the police about what information do they have that they would be happy to share back with other health and care providers. So those three projects are all very much kind of current ones for us and things that have been happening this year. I said at the beginning that they have, three things in common as well. So the chance, the kind of challenge, and then the importance of champions. So I think chance, I think sometimes you just need a bit of luck, don't you? And I think if we take the Children's Project, for example, we were lucky that there was a local government grant that was available that we spotted. And we were even more lucky that we were successful. And what that meant was that we had the funding so that we could actually essentially pay our 3 local authorities for their kind of people time to do the work, as well as for some of the work that their system suppliers needed to do, like the liquid logics and so on. And so, that was just good luck. I suppose also if we kind of take some of the work that we've started to do now around organisations like the charity and the kind of third sector ones that I've said around the sort of homeless arena, I think it's just chance and luck that through Dr. Mike we've been able to do that. And I don't think that I would have been able to engage with them quite so easily if it wasn't for him. Challenge then. So the police sort of safeguarding trial has been a huge challenge, and I think it's probably fair to say that quite a number of the Connecting Care partners had really quite tangible suspicions about doing anything with the police, and were really quite unwilling to do it. So we had to do some work and go on a bit of a journey just around actually getting people to a point where they were happy to do that. And we had to be really clear on the boundaries about what that work was going to be. And we introduced some specific things around it, so additions to our audit reporting, for example. I think the children's project has been a huge challenge. So we spent literally months in workshops with doctors, nurses, social workers, all the kind of people who are involved in child safeguarding and who sometimes don't know each other, never meet, don't work together. And through those workshops, we came up with the kinds of information that they were happy to share. And I suppose you might think, well, it was safeguarding, surely that would have been easy. But we had some quite challenging stakeholders, and it wasn't easy. And actually for us, it became a condition of the project that we had to invite in the Information Commissioner, the ICO, to really scrutinise everything that we were doing. So that was kind of scary, but it actually worked out really well, and it was a really positive experience. And the kind of recent work that we've just been doing with Mike, I guess some of the challenges there are maybe information governance challenges around how do we share where there's, someone isn't a commissioned provider, and how do we find the right legal purpose and that kind of thing. So 3 areas, all of, they're all challenging in their own way. So champions, I think that I'm in the position on the Connecting Care programme where I have no carrots, I have no stick. And so having champions really makes the difference. If I think about Dr. Mike and all the work that he's doing, that's just fantastic. We wouldn't do it without him. The work we've done on the children's safeguarding wouldn't have happened without literally about 3 or 4 people. Getting the work underway with the police happened because we had somebody in my programme team who basically said, yep, it's tough, yes, people won't necessarily want to do it, but we need to push on, this is really important that we do this work. So champions make the difference between something happening or not happening. And benefits. So this is what makes the challenge and all the hard work worthwhile, isn't it? And I think some of these quotes are a bit funny, particularly the Messiah one, really. But yes, it's great. And it is wonderful to be working in the area of safeguarding and to really, then talk to people and to hear that it's making such a difference. Now, Ben asked if I could just say, well, how does this work fit in with your overall plan and kind of what other stuff are you doing? So I thought just kind of briefly that it does fit in with a number of other projects. And so those things there are all things that we are actively working on this year. So from document sharing to more context launching to radiology, pathology. If anyone's done images, I'd really like to know because we want to do images. Definitely around personal health records, where I think we want to look at Patient Portal Plus, so really what's the kind of platform as opposed to just thinking that there's one thing that everybody has to use, but also end of life and so on. So that's all, my team are all kind of actively working on those things. I think the other thing Ben kind of said was, well, what about your roadmap, and kind of future, what's happening there? So we have a lot of ambition to do, some amazing things around stuff like cancer and maternity and mental health particularly. I suppose, how does our roadmap get defined and delivered? Our organisations do have a strategy, of course, and our STP has got aims and ambitions for sure. But I think sometimes I feel that maybe I'm making this up as I go along. So it's yeah, I don't know if you can empathise with this. And so I would say that what is it we do? So we go where the energy is. We go where the opportunity is, or where there's a chance to do something. And we go where there are people who are willing to work with us to make something happen. So our roadmap is partly defined by all the kind of grown-up, strategic stuff that is, laid out that we know we need to do. And it's also organic, and it develops, and things evolve over time. And for us, it's always been that way since the beginning. So that's me, and that's Connecting Care, and that's the work that we've been doing around safeguarding. I hope you found it interesting, and I am really interested to find out more about what you've been doing and all the fabulous stuff that you're working on. If you want to connect with me, those are my details, and I would love to hear more. Thank you.
Thanks, Jocelyn.